Thank you very much. So in this presentation, I will be talking about how we can improve healthcare through education, leveraging techniques in learner analytics and data science. So begin with a very high-level question that we ask ourselves in our field in education and also in where we train physicians and health professionals, is how we improve learning. And this has been a question that we've been asking ourselves for quite a long time. And in fact, if we look at research in this area, over 5 decades, so half a century of work has been dedicated to this area. And there are many solutions that people have proposed. But what's been remarkable is the consistent type of ingredients that we see that leads to improvement in learning. Some of this is due to instructional approaches prompted by active learning. Another is through feedback. And when we find that these are the 2 key ingredients, the thing that we try to do is to integrate these 2 aspects. However, here is the problem. Because of infrastructure, resources, and feasibility, it becomes very challenging for us to put these things together. And here's where we've been working in the last 10 years, which is to leverage learner analytics and data science. And UIC, in fact, has been a pioneer in medical education for over 65 years. In fact, we've led pioneering efforts not only here in America, but also around the world in many of our international efforts. And so our work has tried to focus on not only training health professionals, but how we can translate this effect into better healthcare and healthcare for patients. So let me share some of the examples of the work that we've done in our department where we leverage some of these tools. About 10 years ago, we started using mobile applications to provide real-time feedback through a data hub facility. And this has been used for residents and being a model across the country. We've also used AI-based avatars to have virtual patients where students can improve their clinical reasoning skills, and also for using natural language processing for students to synthesize the information when they meet with the patients that can be also provided in real time. About 8 years ago, through a need in the community, but also motivated by some of our partnerships, we began to create something that's quite special and that only exists at UIC, which is to create a national data hub for physicians, for all physicians that are training in the United States. And over the years, we've used this infrastructure to do some things that are quite important as we try to link education with healthcare. So some of this work leads to translating education to patient outcomes, where we're doing studies that directly demonstrate education leads to healthcare. And this work is continuing with many partners and collaborators, both here at UIC and also across America. Thank you very much.